Nivolumab is a programmed death receptor 1 blocking antibody. Its brand name is Opdivo. In this presentation, we will refer to it using the brand name. It is an immunomodulator, which is a chemical agent that modifies the immune response or the functioning of the immune system. It was approved in 2014 for advanced stages of lung, kidney, bladder, and melanoma cancers. Also, in more recent years, it has been approved to treat classical Hodgkin's lymphoma in those who have relapsed following stem cell transplantation. Although approved for all the aforementioned conditions, it is mainly reserved for unresectable, which is those that can't be removed by surgery, or metastatic melanomas that no longer respond to other drug therapies. Opdivo should be avoided in pregnancy, especially in the second and third trimesters, where studies have seen an increased risk of harm to the fetus.
To stop cancers from forming or metastasizing, the immune system needs to be able to differentiate between normal and foreign cells. To do this, our immune system uses checkpoints. In cancer, we typically see the cancer cells avoiding these checkpoints. This allows the cancer cells to continue to multiply with no immune system to keep them in check. Part of the immune system is T cells. T cells is a T lymphocyte that plays a large role in cell-mediated immunity. These T cells interact with antigen-presenting cells located on a tumor or cancer cells. During this interaction, there is a binding between programmed death 1, other known as PD-1, which are present on T cells. It also binds to its ligand PD-L1, which are present on antigen-presenting cells and tumor cells. This is one of the immune checkpoints. Cancer cells can increase these number of programmed death 1 proteins, allowing them to avoid an immune system attack. Monoclonal antibodies that disrupt the PD-1, PD-L1 interaction serve as inhibitors of this immune checkpoint and have demonstrated favorable activity by boosting the immune system against cancer cells.
Opdivo is a human immunoglobulin G4 monoclonal antibody that binds to the PD-1 receptor and blocks its interaction with PD-L1 and PD-L2, which stimulates the immune response to fight cancer. The PD-1 receptor-mediated T-cell inactivation is disrupted, which leads to normal T-cell activation and function. When PD-L1 binds with PD-1, in absence of the antibody, the cancer cells blocks the T cells, which then blocks the attack on cancer cells. So, Opdivo is good in regards to this. The T cell won't be blocked and the PD-L1 won't bind to the PD-1. This will then reactivate the T cells, allowing them to attack cancer cells. Like any other cancer drug, even though it has an effect on the tumor, Opdivo could also affect normal cells.
Opdivo. The letters PDI in the word Opdivo can stand for PD-1 inhibitor to help you remember.
So there are two types of drug resistance, innate and acquired resistance. Innate resistance are those that fail to ever respond to the therapy, while acquired resistance are those that initially respond but eventually develop disease progression and no longer respond to the therapy. Mechanism of innate and acquired resistance to immune checkpoint inhibitors are not fully understood, but at this point we all understand that successful anti-tumor immune responses following PD-1 and PD-L1 blockage require activation of antigen-experienced T cells. So the failure of the therapy can result from insufficient generation of anti-tumor T cells because lack of sufficient or suitable monoclonal antibody or impaired presentation of monoclonal antibody can all lead to impaired formation of tumor-reactive T cells. Moreover, insufficient T cell function can arise from many factors. It could be mutation or high level of PD-L1 on tumor cell and PD-1 on immune cells, or high level of immune system suppression. Lastly, impaired formation of T cell memory could be a reason of this drug resistance.
Some of the common side effects of Opdivo are fatigue or lack of energy, pain in the muscles, bones, and joints, decreased appetite, upset stomach, cough, constipation, dyspnea, which is difficult or labored breathing, diarrhea, and rash. Some of the rare or serious side effects include immune mediation of the lungs, which is inflammation of the lungs, and these symptoms may include new or worsening cough, chest pain, and shortness of breath. Immune mediation of the colon, which could lead to holes or tears in the intestine. Symptoms include loose stools or more bowel movements than usual, and severe stomach pain or tenderness. Immune mediation of the liver, which is inflammation of the liver, or in other words, hepatitis. Some signs and symptoms to look out for are yellowing of the skin or whites of the eyes, nausea or vomiting, and dark urine. Immune mediation of the kidney could lead to nephritis and even kidney failure. The signs of kidney problems include a decreased amount in the urine or blood in the urine, and as well as a loss of appetite. Immune mediation of the thyroid is a sign for hormone gland problems. The signs and symptoms that lets you know if your hormone glands are not working properly are extreme tiredness, dizziness, headaches that will not go away, feeling cold, or even hair loss. If any of these serious side effects occur, contact the doctor. These risks of immune-mediated adverse reactions may require the treatment of corticosteroids, which this could lead to withholding or discontinuation of Opdivo. Based on the mechanism of action, this medication can cause fetal harm when given to pregnant women, so it would be best to not give this medication to this population.
As mentioned before, based on its mechanism of action and data from animal studies, Opdivo should not be given to pregnant women due to fetal damage. Opdivo crosses the blood-brain barrier and causes greater fetal damage in the second and third trimester. Women who have a high risk of potential pregnancy should use a highly effective birth control for at least 5 months after stopping Opdivo. It is not known whether Opdivo is present in breast milk, but because many drugs, including antibiotics, are present in human milk, and because of potential for serious adverse reaction in nursing infants from Opdivo, women should be advised to discontinue breastfeeding during treatment with Opdivo. Opdivo comes in one dosage form, which is IV, with the strengths available 40 milligrams in 4 milliliters and 100 milligrams in 10 milliliters, which are the same concentration but different volume solutions in a single-use vial. Opdivo volume distribution is 6.8 liters. With a half-life of 25 days, Opdivo reaches a steady-state concentration at 12 weeks when given 3 milligrams per kilograms every 2 weeks. Because the half-life is so long for Opdivo, this is why it's so important for women to continue to take birth control for at least 5 months after stopping Opdivo. With the drug lasting so long in the body, you would think that there would be a need for dose adjustment, but there are no dose adjustments recommended in patients with renal impairment, and there are no dose adjustments recommended for patients with mild hepatic impairment. But Opdivo has not been studied in patients with moderate or severe hepatic impairment. There is also no information on overdosage with Opdivo or known metabolism or transport effects. Even though there are no dose adjustments for liver or kidney damage, monitoring parameters such as hepatic and renal function tests are a must. Given as a 60-minute intravenous infusion on one day every 2 to 3 weeks using a sterile, non-pyrogenic, low-protein binding inline filter. No other drug should use the same IV line as Opdivo. When Nivolumab is used with Opdivo, Opdivo should be infused first, followed by Nivolumab using a different bag and filter. There are not many drug interactions found with Opdivo, but it can cause an increase in Nivolumab side effects such as nausea, insomnia, diarrhea, and some infusion-related reactions when it is used around the same time frame. Immunosuppressants are another rare drug interaction which causes a decreased effect of Opdivo.